Hello everybody, this is the Dr. Pieter Troost. I introduced myself previously and we had a discussion about general ENT service that I provide. Today we would like to give you some more information specifically about nasal problems as well as sinus problems. So the nose and the sinuses that's located around the nose. So this is a very common problem for the general population from childhood up to old age. It affects everybody. And one of my focus areas and that I practice in is to investigate and to eliminate this problem for my patients. So the general perception of nasal problems is when you have a blocked nose and you cannot breathe through your nose nicely. Obviously the nose is also the organ of smell, so sometimes that affects your smell, and with this smell problem you can also not taste your food as well as you should. And that also can lead to sleep problems, so you don't breathe properly at night and therefore you have sleeping difficulties. Obviously if the sinuses are affected, which is located around the nose, then you have congestion, pain, discomfort, which is really impacting negatively on the quality of life of patients. So when a patient comes to see me with these problems, and usually they've been having this for quite a while, and I've been getting medication on and off from the general practitioners, but still doesn't actually resolve the problem, then the best is to come and see an ENT like myself, and we investigate the patients in our office here. We have a specific endoscopy apparatus that we look into the nose with, look at the septum, that's the little structure here, if that is maybe deviated and skew, see if there's polyps in the nose. We do a general ENT examination as well. And then we usually send the patients for a CT scan of the sinuses. So in the office, we've been able to look into the nose with a scope, and I know what the nose looks like inside. But then we do a scan, and that is something like this that comes back to me, which is showing us very nicely the sinuses and what they look like and any pathology or disease within the sinus. So we don't have to guess about it. We can clearly see what's happening in the sinuses. Then after that, we will also send the patient, or actually at the same time, send the patient for some allergy tests, usually tests that look at normal hay fever type of allergens, as we call it, causing sneezing, itching, swelling in the nose, itchy eyes, itchy nose, blocked nose, because of swelling of the mucous membranes due to the allergy. And the patient then comes to see me, we discuss the scan, we discuss the allergy test, and I formulate a plan how to resolve the patient's problems. So treatment usually depends on what we see on the scan and on the clinical examination as well as the allergy test, but could involve one or all of these modalities, which would be sometimes surgery, where we wash out the sinuses, clean out the sinuses, straighten the nasal septum, remove polyps in the nose if indicated, and that will help us to improve the nasal airway for breathing, smelling, sleeping, and so forth. We also wash out the sinuses, open the openings of the sinuses so that they can drain and ventilate better, and by doing so, prevent that congested feeling that the patients suffer from. Sometimes allergy tests, if they are positive, we need to give allergy medication and treat the allergy problem for the future. And depending on any other medical problems that might be related, we can also look at those other type of medical problems that could be related to nose and sinus problems. Of course, the sinuses can sometimes affect the lungs with a chronic cough, and many other problems can be related to that as well. Also, snoring and sleep apnea is also linked to a blocked nose and sinus problems, so sometimes we will also look into that aspect if that is a problem and do a sleep study and also evaluate that. So I hope I gave some information about the management and the way that people present with sinus problems, and please feel free to contact us and contact me so that we can improve our patients' quality of life.